doing?
Well,
How are you feeling this morning?
I feel, as I explained to my wife, my daughter, I feel better, but only because I'm not moving.
And probably because it's
I've
got
been in
fluids.
bed for over 20,
Good point.
almost 24 hours now.
My understanding that you took a lot of diuretics and that made you feel more
Well, if that's the
lethargic
finding,
or
I don't
weak?
know.
We're not sure what it is.
What happened at home?
So he was good. He started. We went to the heart doctor, and he seemed okay walking in and out, but they listened to his lung and heard the fluid on his lung. So he was taking a diuretic every other day. So he asked him to take it 5 days in a row and then do a blood work, which he hasn't done. So he's been taking the diuretic 5 days in a row now. So we don't know if that has anything to play with it or the dehydration.
How long he's been on the diuretic with the original regimen?
He's been on the how long has he been on the diuretic?
For how long?
Forever, basically, right?
So the
well,
recent
over
changes?
well over a year.
It's
Okay, and that's the first time we make a change for a long time?
He was on it, I want to say every day, and then they changed it to every other day.
Yeah,
She's hard of hearing, just so you know. That's why I'm here.
Yeah, they reduced it from 5 times a week to 3.
Okay.
And then when they found the
then
fluid,
when I had this problem now with the water on my lungs, he increased it back to 5 again.
Now-
He said only though for 5 days.
Okay. See a lot of swelling there.
there is.
Not really.
Oh,
Let me take a listen to your line. Can I check your back?
Sure.
you sit up then. You need to sit up though. Yeah.
Very good.
You need help?
Very good. Very good. All right. You can take a deep breath for me.
They said it was the left lower lung.
Thank you.
No,
Wait, Dad.
Let's do that one more time. Well, the lungs sound fine. You know, it's not really that congested. There's, some crackles. And you're right, because you're staying in bed, it needs more air in and out, more ventilation. You know, when you start moving your body, you get more air in your lung. But when you stay in bed, it's kind of shallow when you breathe. Okay? So you're right, moving would help. Have you done any physical therapy today yet? Okay. Yeah, we definitely need to do that, at least to get an evaluation and see.
I have some information. Let me give him.
Wait, Dad. Just wait, Dad.
physical therapy.
Why is that?
Something came up with
Because I
a.
can't stand. But in the last 3 months, I've fallen 3 times. And out of the 3 times I've fallen,
Yeah.
3 out of 3 have been to the
How's
right.
your day at home? Do you stay in a chair all day, or
Yes.
do you walk? Do you walk at all?
No, not much, no, I'll be honest, because
Okay.
of the way I feel.
He used to be more active. He would do
Yeah.
the dishes. He'd go to the mailbox, in and
Okay.
out. But he's gotten
So he's
slower and
I'm
slower.
afraid of
Sitting.
falling, quite
More
honestly.
sitting than anything.
Okay.
And last night, another doctor was in here, I didn't catch her name, but she was in and she suggested, and this was something new I never even heard of being brought up before, doing an MRI on me
Mm.
because of these falls and the proponents
So you fell,
one
although you're
direction.
not walking much, right?
Going to the bathroom.
Okay. So like only necessary trips.
Yeah,
Okay. So how did we notice the weakness if you're not moving that much, if you're sitting all the time? How did you notice? What's different?
Because anytime I got up, I was weak, I was ready.
To the
Well,
bed, to the
that's
bathroom.
something
I
called
was ready to
deconditioning.
fall.
Yeah, that's something called deconditioning. When you're not using your muscles, they will become sore and weak. They will become weaker. If I put a 20-year-old in bed for 3 days, he will have weakness.
Mm-hmm.
So not moving much, believe it or not, that's the reason you're becoming more unable to walk. So
That's what Mom's been saying.
We can fight that back, but it's gonna take time. We have to do physical therapy and we have to be consistent on it.
Mm-hmm.
We have to be active, basically. If you would like to stay sitting most of the time,
You're
your
gonna feel
muscles
bad.
will become weaker. And we have groups of muscles like here in your thigh, in your core. These are called proximal muscles, big muscles. If they become weak, the peripheral ones won't matter much because that carries your weight. And if you're sitting all the time, 3 months is a long time. Your body will be very weak.
His
And
legs.
You'll probably, that has been building up and then changing the diuretic. That by itself is not a big deal, but the fluid shaft in your body with all that, that's definitely would make you feel a big difference.
Should I take this down a little bit?
Well, we
No.
prefer
No.
not.
No,
Why do you need it down?
Because I feel like I can't talk.
I can't. We can
No,
hear
you
you
can
fine.
talk.
You're good, Dad. We hear you.
After I talked to the doctor last night, I told her that my mother had TIAs
Had
at
what?
my age. She
Mini
had
strokes.
Pretty regularly.
Mhm.
And that's when she came up with the idea of
No.
doing
No.
an MRI on me.
All right.
Now,
I can't compare your condition to anybody else.
I have to
no,
talk.
but
You will.
it could possibly run in families.
It does,
Raise your
but
hand.
we don't rely on that. No.
I have to talk. I
I'm
know
not-
more
I'm not
about everything that, Ray, I have to
Dad,
speak.
wait a minute.
I have to speak, okay. He had a SPECT scan, SPECT scan, that came back normal. He's had,
That was for talking.
Yes, just listen, Dad.
he's had, multiple brain, scans, everything's come back normal, okay? He's seeing a, neurologist now. He's been taking, Haldol very successfully. He had, extreme,
Hold on for what indication?
hallucinations, extreme.
Yeah.
Okay.
Bad.
When he was in here the last time, the neurologist recommended a medication that didn't work for him. They had a psychiatrist come in. He recommended the Haldol, and it
And the
was like a
hallucinations are
miracle
coming
cure.
because
Okay.
of dementia?
That's what they're saying.
Okay.
Now, the last time we saw the neurologist, which was last week, she gave him a prescription for Donepezil. He was on it for 8 days, and he got weaker and weaker and weaker.
She
I
noticed it.
decided
Mhm.
to take him off of it. And it was on a Saturday, I think, and I called and spoke to her husband on the emergency. And he said it was okay. My thinking, I don't know if I know what I'm talking about, is that the side effects of this seem to be what made him worse. If I'm right or
He
wrong,
stopped
I
it
don't
already,
know,
right?
okay?
I'm sorry.
He stopped it already?
He's been off for about 6 days.
Yeah. So,
Not off the dollar.
now,
It doesn't stay in the system that
is
long,
it
and
a
it's
possibility?
definitely-
Let me just explain one more thing. One day last week, I think it was on Monday or Tuesday, we started to have physical therapy come back in. Now, the physical therapist came in and she worked with him and he walked when she was there. And he also used this pedaling thing that we have, that you sit in a chair and you pedal. And he did that pretty well. But then he just started, it seemed like the day after that, he just went so downhill. And I don't know whether it's
Well,
the
you know,
dementia.
if,
The only thing with his dementia, mentally, his short-term memory and his long-term memory is fine.
Yeah, he
Okay.
seems pretty good.
Well, what is the main problem we're treating?
What is his main problem?
Yeah.
Weakness.
Fatigue,
weak-
weakness.
Okay. Because
And
it
lack-
seems to
lack
be
of
a
balance.
collection of too
Yeah.
many things, you know. I can tell that there's definitely some dementia going on. This is a treatment for it, you know, if there's a side effect for it, you know,
You can't hear?
I can't hear you. She'll tell me
She
what
reads lips more.
that's fine. So the Aricept, or the Donaldsonville, that's for the dementia, okay? The hallucination can be explained by that. So the weakness, like I said, it's probably not from the medication because
Okay.
it's been off for about a week now.
Right.
But not moving for 3 months and the fluid shift that happened because of the diuretic. I wouldn't blame it on that, you know, diuretic is still needed.
Sure.
Maybe we can go back to every other day. That shouldn't be a problem because we can always give an extra if we
And
need
his,
to.
his lungs seem not too bad right now from what you hear?
No, not
Okay,
at all. And yeah, and we can always give an extra dose. It doesn't have to be consistent
Well,
I
every
see.
other day or every day.
Are we
I tell
dealing
my
with the
patients to
same-
weigh themselves. You know, if there is more than 5 pounds overnight, take an extra dose. You know, that's easy to do. You don't really have to take a lot of diuretic to make sure you're euvolemic.
They were just wanting to do it because they wanted to try to get it off of his lung and then have him do a blood work after that, so.
That's fine. I mean,
He's
we
a-
did already yesterday.
You
And
did
the
the
only
blood?
thing it showed that their kidney function is a little affected by that.
He's had some issues with his
Yeah,
kidneys.
so yeah, obviously. I mean, it happens, all patients.
Okay,
But the weakness is a buildup over a few months. Okay?
then,
I have to ask you a
So,
question.
if that is the main issue we're talking about, then
Yeah.
we can consider a rehab or something. But is he willing to do
I
that?
would rather him
No, I
come
am
home if
his
possible.
caregiver, you know, I'm his wife. And I asked the neurologist, because I honestly don't know what to do, whether she thought I should encourage him to keep doing the physical therapy. And she told me to tell, he should do what he wants to do. And at
And
that
that's
point,
nothing.
what he wanted to do is nothing, so is it advisable for me to have these physical therapists come in?
I would say
couple
the
of
same
times a
thing.
week.
I mean, he's the one to decide.
What?
You know, to do physical therapy, there has to be motivation,
So your answer is yes, but he has to be motivated to do
right?
it.
Well, she said that he needed a motivation, this physical therapist. She asked him what he liked to do, and the one thing he likes to do best of anything is go to a casino.
Hmm.
So she said, tell yourself, I wanna go to the casino, that'll be your motivation. So I wanna ask you, should I encourage the physical therapist coming in?
Definitely, yeah,
Yes.
No problem,
definitely.
no
He-
problem with his
He's
health.
capable. The question is, he's capable.
He's
Well,
capable.
we have to get an evaluation and build on it. You know, I can tell. He's right. If he's staying in bed, I can tell how
Right.
weak or how strong he is.
Sure.
So, you okay doing some physical therapy evaluation today?
Yes.
Well, we here?
Yes.
No, at
They,
home.
they have to evaluate you, Dad, so the answer
You
is,
said here.
Dad, they have to evaluate your
I had the evaluation last week.
physical therapy. Not here. We're in the hospital
It's
now.
not, it's not valid anymore. We have to make a new one.
You're in the hospital now, so we have to redo it.
I'm not gonna deal with those people.
Yes, you are, but
We
they
can.
wanna see what you're capable of doing here.
Yeah. I care more about how you're doing today, not
Oh,
last week.
okay, oh, okay.
It's just to evaluate what you're capable of doing.
Okay, so I'll get the physical therapist to see you. Okay, there is just a gentle hydration that we're doing right now.
He
And we'll see
has
what
that
the kidney function
problem.
is
He
tomorrow.
gets dehydrated, he comes, he gets a bag of fluids, and he's a different person.
Mhm.
So I push him to drink, and his heart doctor says he should have 1 liter a day.
So, okay, that's a good point. With the heart failure, it's
Yep.
hard to stay in the good zone.
Right,
You can be fluid overloaded or dehydrated.
sure.
Okay, weight is a good thing to follow. Okay, with some margin of error.
Right.
Okay, so when he's in a good shape or he's usual, see what his weight is. Okay, plus or minus 5. If it's going up, give extra diuretic. If it's going down, it's probably not going to go down.
So we should be
okay?
buoying him every day?
We should. Yeah.
Oh, okay.
We should. Okay?
Okay.
So,
I gotta come here every day for therapy.
Is it
No,
advisable
Dad.
to keep him off
We have
that?
to weigh you every day to see if you.
No, he said every day here.
No, you did not.
no,
Wait.
you don't have to.
Weigh you every
We
day.
possibly can go home tomorrow. But today, let's do physical therapy,
Yes.
keep the fluids, recheck the kidney function in the morning, and we go from there.
What did you have a question about?
Okay?
Did I make the right decision? Is it, harmful if he doesn't take the donepezil?
If there's a side effect, I wouldn't take it. I would just wait to follow up with a neurologist to discuss an alternative.
Yeah, well, I think that's the least of his issues right now. But the biggest thing is the Haldol, and I understand that they took him off, that they don't have it on his medicines for today, but he takes it.
Oh, they came in, they put it back on.
Oh, good, because he
They
takes it
gave
in the
it to
morning and at night, and if he
That's fine.
doesn't have it, he's gonna
They
have the
gave it to me
hallucinations,
at all
so.
That's fine. I'll make sure it's there.
Perfect.
They
Okay.
also, they changed the throw ball.
All right. Sounds
Did you
good.
know that?
So bottom line, yeah, Dad, I'm sorry, bottom line is, what? What are we getting out of this with him being here?
Once he gets home, start with the physical therapy again.
That's right.
But he's here because of dehydration?
Well, you got him here because of the weakness.
Yeah, and that was
it's a
caused-
build-up because combination of the weakness from not moving and
Yeah.
the dehydration.
Okay.
Yep.
Well, when
That's
he
what I
gets
needed to
home,
hear.
if he's still so weak, he'll still have to be getting up and down to go use the bathroom.
That's right.
So the question is he able to come home? So they're gonna evaluate him today,
Okay,
Yeah,
okay.
yeah.
right?
Okay, that's right.
Thank you.
Absolutely.
Now, is it necessary for him to have that MRI, bringing he had this scan?
Well, yeah, I would think it's a good idea to make sure that there is nothing acute going on. I don't think there will be any problem, but we usually do it to make sure the brain looks.
Do you need to
okay.
see
Now,
the
the
MRI
doctor-
card that he has a pacemaker?
It's compatible,
It's-
isn't it?
We have it.
I believe so.
Or showing the
We have the
picture.
card.
Yeah,
Okay.
well, this is for the MRI tech. They
I
have
know
to-
we're
Oh,
making
not
your
for you?
brain
You
like
don't need it?
crazy, but I just need information.
You don't need to see the MRI card?
They have to screen it, yeah, they have a questionnaire that they have to go over.
I spoke to the neurologist's office, if you want any of the records from them, to just get in touch with them.
There's been a,
Are they in the system, the Texas Health System?
we called them to ask if they could send it here. They said that.
That would be great. They would
Okay.
just have you sign a release.
You have to
but
request
They said
them.
they
Yeah.
wouldn't, that the hospital needs to
Do I
request
tell the
them.
nurse that, to
Okay,
request
I'll
it?
take care of it. I'll let
Okay.
her know.
Okay.
Okay?
Do you
Very
need-
good.
Do you
Nice
need
to
the
meet you.
neurologist's name?
I'll have the nurse have you sign the release and we'll ask for the records.
Very good.
Okay?
Any more questions, Dad? You good?
I'm gonna go to rehab right after this.
No, they're gonna come up here, right?
Well, yeah, the physical therapist will.
Yeah,
be
the
there.
physical-
Okay.
Thank you
Thank
very
you.
much.
You're welcome.
Is this it?
Dad, put your mask on. Yes.
Here's your card.
Keep it handy.
Huh?
Keep it handy.
It's handy. I could have asked him a million questions.